The World Health Assembly has, for the first time, recognized stroke as a global public health priority and passed a landmark resolution calling on member nations to strengthen prevention, treatment, rehabilitation, and long-term care systems. The resolution urges countries to improve risk factor control, ensure timely emergency treatment, and expand rehabilitation services, while also enhancing health system readiness and accountability. According to the World Health Organization, stroke affects nearly 12 million people every year, claims more than 6 million lives, and leaves many survivors with lasting disabilities. For India, the resolution carries added significance. Studies estimate that the country records anywhere between 108 and 172 stroke cases per 1 lakh people annually, with a 1-month fatality rate ranging from 18 to 42%. Experts say strokes are occurring at a younger age in India now, and they warn that the shortage of neurologists and neurosurgeons remains a major challenge. However, they stress that many risk factors, including hypertension, diabetes, tobacco use, obesity, physical inactivity, and unhealthy diets, are preventable and reversible. Health experts have described the World Health Organization's resolution as a wake-up call for India and an opportunity to strengthen stroke prevention, early intervention, and rehabilitation through better use of technology and healthcare infrastructure. We have Dr. Ishwar Jilada, Consultant Secretary General, People's Health Organization, now joining us on the broadcast. For more on that, thank you, Dr. Ishwar, for taking time out to be with us. Straightforward question. When it comes to these new age lifestyle diseases, becoming a pandemic of their own, stroke is often overlooked. Now, thanks to the World Health Organization's resolution, there will be greater focus and the spotlight put on stroke and its dangerous consequences.
Thank you very much for having me on the show, and it's better late than never.
Yeah.
Itself is the third largest killer, even for India. So after the cardiovascular deaths or respiratory deaths, stroke is the number 3 killer, even more than the cancer, more than diabetes, more than many other diseases or traffic accidents. And nowadays we see stroke in young people. But during COVID, we thought that people will improvise because people were becoming conscious. They wanted to have a good lifestyle. They wanted to have a good immunity. But what I see, if I compare pre-COVID era, COVID era, and now, actually it has become bad to worst. People have become sedentary. The work from home is a new norm for many companies, many organizations. And work from home is not even mobilizing themselves for taking breakfast or tea or coffee. At the same table, they want everything. So with young people, they are having more and more problems related to hypertension. We see hypertension even at the age of 25 or 30, which is usually seen after the age of 40, which is called essential hypertension. Diabetes onset quite early, obesity, junk food, or a lot of food which is processed, ultra processed food. I think all these are contributing. In addition to that, we have also pollution. Also COVID. During COVID, a lot of people who were affected, they also get stroke. So I think stroke has multiple factors. Good that WHO has recognized this as a major problem, and more so for young people, because young people, they have a whole life to go. So if they succumb to stroke, or even if they don't die, they develop disability, it becomes very difficult.
Okay, Dr. Ishwar Jilada, the question I have to ask you is on behalf of all the people watching this broadcast: how does one get into early detection and prevention of stroke? Because right now what the average person does these days is that they do their annual blood tests and that's about it. But for stroke, I guess, that's not going to be enough.
I think we need to train people on 4 words, FAST. F means face drooling, or something is coming out of face. Then is the arm weakness. And third is the speech difficulty. And fourth most important is time. So if you are able to mobilize the person from the stroke affected area or home to hospital in less than an hour or so, I think you can save that person.
Okay, so that's, as far as when the stroke hits. But the question is that, is there any way that we can know from earlier, that we are more susceptible to stroke, so hence we need to change our diet or lifestyle, as the case may be?
I think whenever somebody comes to the doctor along with somebody else and who is a patient, and we ask that accompanying person, have you undergone any health checkup? They said, no, I don't have any problem. So people want to go for health checkup only if they have a problem. There's no preventive health checkup system. There's no preventive vaccination system. For the first time, we realized that adult vaccination is there only during COVID. Otherwise, vaccination is only for young children. So I think if preventive health is not looked after, then we get into problem. So for stroke, at least we need to make young people aware that they should check their blood pressure once in a while. They should check whether they are getting diabetes or not. Obesity, you don't have to even check yourself. Your weight is increasing. Your clothes are not fitting. Everybody in your family or everybody is saying that you are looking healthy. Now in India, when somebody is looking healthy, that is a good sign. So it's not a good sign; it's a bad sign. So we should understand that if you are inviting trouble because of blood pressure, diabetes, obesity, these are three. But there are habits which are like smoking and tobacco. So tobacco chewing very common in rural area, smoking very much common in urban area. So both either you chew or you smoke, there's a problem. Alcohol, that creates a problem. Junk food, that creates a problem. So if you really want to prevent stroke, you have to prevent all these habits and you have to have a healthy lifestyle, doing exercises, walking, and that is lacking in the young generation, which was seen earlier prior to COVID. After COVID, it is going down rather than increasing.
Also tell us, how does one sort of prepare themselves, especially when it comes to the people in the later stage in their life, people who are 40 plus, 50 plus, 60 plus, even so how does the risk of a stroke increase progressively with age?
See, risk of stroke will increase because of the causative factors, and the most important being the hypertension. A lot of people, even and nowadays, what we see earlier, hypertension means we used to have a person coming with a headache or a kind of uneasiness. Now, blood pressure is 190, 120% say no, I don't have any headache. So I think this is a very strange phenomena happening nowadays. So blood pressure is very important because that is one of the factor which gives rise to stroke more commonly than other factors. And that can be either hemorrhage, which is a bleeding, or it can be ischemia. So both the type of stroke can be there because of that. So I think we need to make people aware that they should be preventing all these things by their own habits. And most important habit is being exercising. Even if you are working in the office, just go out and in, out and in. When you go out, it is not for smoking. Most people go out, yes, they go out for smoking. So that is the wrong thing. So I think uh, alcohol, smoking, tobacco, food, all these or pollution, all these will be causative factors for young people or anybody.
It is important at this stage to note that you have the World Health Organization putting, stroke under the spotlight. But do you think India's medical system is prepared to, take on this burden of stroke that we have? Clearly.
See, there is a rural-urban divide. So urban people they have access to care much more faster because there are a lot of hospitals, and in rural areas they are not having access to kind of good medical care. So actually, for any kind of emergency, whether it is a stroke or accident, etc., the equitable system should be there. Very good system that government of India started, that medical colleges are there all over the country now. Earlier, there were 110 medical colleges when I graduated in 1981. Now there are 860 medical colleges. And the idea is that every district should have one medical college. Medical college means a hospital. And therefore, anybody should be able to reach there and get treatment. But basically, we need to make people aware about the fast, which I was telling you. They should recognize stroke early so that they are able to reach the hospital quickly. And at most places, we need to have a CT scan facility 24 by 7 where we can diagnose whether it is a hemorrhage or ischemia. So I think diagnostic facility, suspecting facility, equitable care, these are the three most important things. And I think our government system, policymakers and planners should take into mind that one staying in rural area should not be disadvantaged. Otherwise, there will be always a rural to urban migration, and will not be left to the rural areas.
Ishwar, the one other question is, of course, on rehabilitation. There's so many where it hasn't proven fatal, but has left them with a lifetime of disability, possibly. So the rehabilitation of stroke victims is also an important area that needs to get the right kind of investment.
Yes, physiotherapy, speech therapy, looking after them, looking after their nutrition is very important. If they are not able to swallow, we have to see that they sit and swallow something. If they are just sleeping or semi-sleeping position, if they swallow something, it may go in the respiratory tract, and they might die there and then. So I think we need to care. And our days we used to care for our parents. I don't know whether our children will care for us or not. So I think that caring pattern has to be from one to another generation going on. Nowadays, all next generations, they are looking after don't look after themselves. So we don't expect them to look after their parents and their grandparents. So we need to have that caring culture in the family. There are a lot of them are having a STEM family. The parents are left to fend for themselves. In that kind of situation is very difficult situation. And I think there should be community living, community understanding, volunteer organizations role, everybody's role is there, so that we can look after them properly, particularly rehabilitate them if they have not recovered properly.